Immunization is one of the most effective public health interventions in modern medicine. The success and effectiveness of Ontario's publicly funded immunization program depends heavily upon high immunization coverage and vaccine inventory management. Your support to implement proper vaccine storage and handling practices is critical to the health of your patients and the community. You play an important role in making sure vaccines retain their potency and vaccine wastage is reduced. Publicly funded vaccines must be kept between 2 to 8 degrees Celsius at all times. Keeping vaccines within this temperature range during transportation and storage is referred to as the cold chain. The cold chain begins at the manufacturer and ends when the vaccine has been administered to the client. Wellington-Dufferin-Guelph Public Health is available to help your office maintain the cold chain. With proper storage and handling, you will be able to maintain the chain and keep publicly funded vaccines within the required range. To help you maintain the cold chain, Public Health is providing your office with Maintain the Chain training materials and resources, including a quick reference guide to vaccine storage and handling. It is important to maintain the chain at all times because vaccines that are exposed to temperatures outside the range of 2 to 8 degrees Celsius may be damaged, resulting in a lack of protection from vaccine-preventable diseases, vaccine wastage, and increased healthcare costs. It is not always possible to replace vaccine quickly due to intermittent vaccine shortages. As a result, it is very important to properly store and handle the publicly funded vaccine you receive. You will be working with 2 public health staff concerning your supply of publicly funded vaccines, our vaccine coordinator and a cold chain nurse. When you place your order for publicly funded vaccines from Public Health, our vaccine coordinator receives and processes your order. Please request up to a 2-week supply of vaccine for your patients. You can either arrange for the medical courier to deliver your vaccines, or you can pick them up yourself with an insulated cooler and packing materials and a thermometer. Our vaccine coordinator is available to answer any questions about your order. Annually, or in the event of a cold chain incident, our cold chain nurse visits your office to inspect your refrigerator and help with your vaccine inventory management. The cold chain nurse responds to all cold chain incidents and is also available for training of new staff or whenever you have questions about vaccine storage and handling. If you are picking up your vaccine order from Public Health, it is important that the temperature in your cooler is between 2 to 8 degrees Celsius. Follow the instructions in the Maintain the Chain Quick Reference Guide. Your Maintain the Chain package includes a sticker for the outside of your cooler to remind you how to pack your vaccine. When your office receives a publicly funded vaccine by medical courier or when you pick it up from a public health location, it is important to store it immediately in a properly organized vaccine refrigerator. Refer to the diagram in the Maintain the Chain Quick Reference Guide for proper organization of your vaccine refrigerator, and be sure to use the vaccine with the shortest expiry date first. Never store any laboratory specimens, food, or drinks in your vaccine refrigerator. At the beginning and end of the day, your vaccine refrigerator temperatures must be checked and recorded in a temperature logbook. Any temperatures outside the range of 2 to 8 degrees Celsius need to be reported immediately to Public Health. Follow the 4 R's. Read the thermometer. Record the current minimum and maximum temperatures. Reset the thermometer by clearing the minimum and maximum temperatures, and report any temperature below 2 or above 8 to Public Health. If a cold chain incident occurs, it is very important to contact Public Health right away. Remember this Maintain the Chain rhyme. Below 2 or above 8, know what to do, take action, don't wait. We are providing you a cold chain incident package that includes forms to be completed and returned to Public Health, and a large sign to put on your refrigerator so everyone in your office is aware that there has been a cold chain incident and not to use vaccine until advised by Wellington-Dufferin-Guelph Public Health. Public Health is required under the Ontario Public Health Standards to respond to all cold chain incidents involving publicly funded vaccines. Remember, a cold chain incident occurs every time vaccines are exposed to temperatures outside the required temperature range of 2 to 8 degrees Celsius. Depending on the length and type of exposure, public health will determine whether or not the vaccines can be used. We will also tell you what to do if the vaccines cannot be used. The cold chain nurse will also provide follow-up education to prevent future cold chain incidents. When vaccine needs to be returned to public health because it has expired or because of a cold chain incident, you need to return it in a paper bag with a completed vaccine return form. You are also required to send back the wasted vaccine with your next order. It is important to have a contingency plan for storing vaccine, especially during severe weather that could result in power outages, and in case of a refrigerator malfunction or during holidays. Please use the form in the incident package to develop your contingency plan for vaccine storage, and make sure everyone in your office knows your plan. You are always welcome to temporarily store your vaccine at a public health office in the event of a power outage, equipment malfunction, or holiday. With your help, we can reduce the amount of vaccine that gets wasted by following proper storage and handling guidelines. If you have any questions about the cold chain, please contact the cold chain nurse. Together, we can protect your patients and our community from vaccine-preventable diseases when we maintain the chain.